Hello and welcome to healthyseminars.com. I'm your host and moderator. And today we're going to have a lecture, a webinar. The topic is Enhancing Fertility for Couples Over 35, Specific Recommendations on Nutrient Supplementation for Women and Men. And our speaker is Dr. Marc Sklar. And I want to give a big thank you out to Fairhaven. They have sponsored today's webinar. A little background. We run the Integrated Fertility Symposium since 2015, so 5 years straight. And in 2020, we had to cancel because of COVID, and Fairhaven was planned to be there. And I use a lot of their products, and I know the team there. And they said, hey, we were planning to be at the IFS. We had a fee rather than giving it back to us. Maybe we can sponsor something for educational for all the people that wanted to come and anybody that wanted to come. And so they organized this. They got in touch with Marc Sklar. Marc is a colleague and a good friend of mine. We actually, just to let you know, he's the president of the American Board of Oriental Reproductive Medicine. He's a fertility expert, Chinese medicine practitioner. And Marc and I know each other well, as in when we have to talk about difficult cases, we'll often call each other up and talk shop. And then when COVID happened, we have to buy equipment. We call each other up. What are you buying for this supply and how are you protecting your tables with this? So I know Marc really well, both on a professional level, that's how we met, and also on a friendship level. And I'm also a fellow of the American Board of Oriental Reproductive Medicine. That's the FABORM.org. So I'm just really excited to have this because Fairhaven was kind enough to sponsor this and asked Marc Sklar to put together an educational webinar for the community on how they can optimize both egg and sperm quality through nutritional supplements. Now, I just want to do a very brief housekeeping here, and it's really brief, and then we'll bring up our disclaimer slide. I just want to let you know that to find the replay for this, you just go to healthyseminars.com, and if you click on the resource page, I'm going to just take you. This is the resource page. Here's June 2020. You'll see on June 22nd, you can click that, and that will take you to this page. And this is where you are going to find the replay. So if you're looking for the recording to watch this again, this is where you come. It's not up right now because we're streaming live. And if you want the handouts for them today, then contact Fairhaven Health directly as well, and they can provide you the handouts that Marc has put together for this lecture. And I do want to let you know that if you come to this page, at the very bottom, there is a special offer that Fairhaven's offering to the webinar attendees. So just read this and find out what they're offering. They have a special that's on until July 15, 2020. They have a great affiliate referral program as well. So I encourage you to check out this page, which is healthyseminars.com/Fairhaven. If you can bring up the disclaimer slide, that would be greatly appreciated. I actually got introduced to Fairhaven when I started using pregnancy tests and ovulation strip tests rather than the real expensive ones that you can get at your local drugstores. They were selling them at the fraction of the cost. So it was nice that I could pass these on to my patients, and they don't have to break the bank to be able to do all these ovulation tests. And they have a great affiliate program as well. So do check out Fairhaven's website. They got great products and great services. Our disclaimer today, just to remind you, this is for educational purposes only. This is not medical advice. This should not be interpreted as medical advice. If you have a health condition, please seek out a healthcare provider. Thank you. All right, let's bring up your slides, Marc. If you have questions, please post them in the chat room. I will moderate those for Marc. He's going to speak for 45 minutes, and then we'll go through the Q&A at the end of this talk. So without any further ado, Marc, please take it away.
Thank you, Lauren. Thank you, Fairhaven Health, for inviting me to talk on this topic. And thanks for everybody watching and who came to join and found this topic important and valuable for them to take out some time in your day. So I do appreciate that. In my practice, we use a lot of Chinese herbs and Chinese medicine, obviously, but also a lot of supplements, nutritional supplements and vitamins and so forth. And I've always had an ongoing conversation with multiple fellows of the ABRM on this topic because, some have a bigger affinity for using Chinese herbs over nutritional supplements, and some have more for nutritional supplements over Chinese herbs. And, I don't think that there's personally think that there's a right or wrong when it comes to that. I just think that each patient needs to be looked at individually based on their specific needs at that moment in time, and deciding, what might be best suited for that patient and that condition. And so I've always found an affinity for vitamins and supplements that we tend to use quite a bit in our practice. And I've always been looking for supplements that are effective, but obviously also have some good research behind it that I can count on, and also make things affordable for patients as well. So, we're always introduced to new things, but I think it's always important for us to come back to the point of what's important, what's going to work, what's going to be cost effective for our patients to get the results that we all want to see. So that's how we put together this presentation for all of you. For those who don't know a little bit about myself, I run a clinic called Reproductive Wellness here in San Diego, California, specialize in reproductive health and infertility. And I won't spend too much time reading my bio and so forth. But I think the most important thing that stands out is that I've been, since the inception of the American Board of Oriental Reproductive Medicine, I have sat on their board with the exception of 2 years where I took a break. And I am now the current president of FABORM, and happy to support our community and this profession, and really excited to be here with all of you today. So let's get on with it, right? So today we're going to cover some main things, but I'm going to focus on some key areas, common issues seen in female patients and how to address them. We're not going to spend too much time on the common areas, but I'm going to cover some key points that I think are important for all of us to remind ourselves about it. But really, as the title says, we're going to really spend our key points and most of our time talking about the nutrients and specific recommendations as it relates to some of these key nutrients. These are just a couple that we'll be going over: inositol, CoQ10, melatonin, and a slew of antioxidants. I always feel when I talk to patients that cervical mucus is really important. So we'll spend a little bit of time on cervical mucus and what potentially patients can do to support that piece, and what we can do to support them. And then no presentation when we talk about fertility and reproductive health is complete if we don't address the male side of things. So I am going to also spend a little bit of time talking about the common issues for male factor and how to address those specifically, again, as it relates to nutrients and supplementation. So some common issues that I think we all see and that we all want to address first and foremost with patients, if someone comes in to the office, as we in the fertility world, we tend to see women who are older and or have been told that they have egg quality issues. This seems to be such a big point, a big conversation that we have with patients. I think it's probably overdone a little bit, especially for our younger patients. When we're talking about egg quality, they just harp on this point and really zone in on it. And so, that's a key piece that we need to address with our patients. Now, one aspect of it when we're addressing egg quality with patients is to, I think, keep them grounded and keep their feet on the ground about it, and, support them emotionally when it comes to that. But also, what can we do to support egg quality ongoingly? And some of that's really going to have to do with oxidative stress and how we can manage that piece as well for them. Cycle regulation, as we all know in Chinese medicine, I don't know how many who are joining us today are Chinese medicine doctors, but I imagine a good piece of those of you watching today, the viewers, are. And from our world, really, we spend so much time on this piece with patients because it's so important, right? If they have an irregular cycle, short or long or none at all, obviously fertility and reproductive function is going to be impaired and compromised. And so making sure that our patients have a healthy, functioning and regular menstrual cycle is of utmost importance. And for me, this supersedes everything else, right? Because without having a regular menstrual cycle, as we all know, then it's going to be very difficult to support egg quality. It's going to be very difficult to maintain hormonal balance, which is the third point here. So making sure that we focus on cycle regulation. I often think that we sometimes get lost focusing on these little topics, so to speak. You know, if someone comes in and says, oh, you know, I really want to focus on egg quality, or I have cysts or endometriosis or something like that. I feel like sometimes those Western biomedical terms are what we tend to fixate on and focus on, and we tend to ignore some of the other things that have so much importance, like regulating a menstrual cycle. And then for me, a key piece that I work with all my patients is running lab work, making sure that I have a good understanding for what their hormones look like. Because I don't know about all of you, but I find that either they have not had enough testing done, or it's been done at the wrong times of the cycle, or they've been told everything looks fine, but they actually haven't seen it themselves. And we can come up with all sorts of stories around this piece. But I really like to make sure that I'm running full hormone panels for our patients, really going in depth for them, because I find that this is ignored. And this only helps me when I'm working with them clinically in deciding what nutrients that I want to start to incorporate in their plan. And so this is why I spend a lot of time in the beginning when I do a workup with patients, is really working on hormone lab testing and getting a good understanding for what is going on there. I think patients really also appreciate this piece because they don't get a lot of attention with this. They're kind of dismissed. They also don't get a lot of explanation, so their understanding of what their hormones are doing and which hormones are important, I find, are often overlooked as well. So they do appreciate this piece. So nutrient-specific recommendations, why is this so important? As clinicians, we're always looking for ways to support our patients, right, to give them an advantage. I also think that they are, the patient, the couple at large, is spending so much time on Dr. Google and navigating the internet to find out what they can take, what's that magic pill that's going to help them get pregnant. And whether you and I believe in magic pills or not, they certainly do. And I think we have to have a better understanding for what all these nutritional supplements are potentially going to do for them and how they can incorporate them and give them the guidance that they need. You also may have heard that using certain nutrients are important for egg and sperm health. And I promise you at this point in the fertility world, most, if not all, of those couples coming to seek your help have probably also read the book, It Starts with the Egg, which spends so much time on this specific topic. And whether you agree with it or not, it's important to know where they're coming from, because that's exactly what they want to do, is improve egg and sperm health. We need to have a solid foundation and knowledge base in that, so we can really support them the best way, and that we can be the ones that they rely on versus the books. Because even though there is research in that book, it might not be appropriate for every patient. At least I actually believe it's not appropriate for every patient. And they do need customization for their specific needs. So even though you have some basic understanding, when was the last time you looked at some good research to support what you do give them, or maybe cause you to second guess and think about some nutrients differently? So that's what we're going to do today, is really look at these nutrients as it relates to the research that supports them. So ionisitol. Many of us really focus on the first one, myo-ionisitol, but I do think it's important to look at both myo and D-chiro. And so myo and D-chiro-ionisitol folate can talk about, methylfolate in this as well. which is my preference, melatonin, CoQ10, and antioxidants in general, B vitamins, and acetylcysteine, they all work together, right? So we're going to separate these, but I do want you guys to understand that they actually work to support one another and can really strengthen the effects of each other, all these nutrients. We're going to separate these two right here, myo and D-chiro. And again, we do speak quite often of just myo-ionisitol. And I do think that most patients will come in talking about myo-ionisitol when they come in talking about ionisitol. But we do need to look at both of them, and both aren't going to be appropriate for everybody, but we do need to understand when it's appropriate to use one versus another. So myo-ionisitol has some insulin sensitizing, is an insulin sensitizing agent, helps reduce insulin resistance in women, improves egg quality. Even mild elevations in blood sugar and insulin negatively impact fertility in all women trying to conceive. So we want to make sure that blood sugar and insulin are very much controlled. And we also know that, at least I can speak for in the United States, that insulin resistance, obesity, blood sugar issues, these are real big issues in the population at large. So this can be a really important nutrient to incorporate into many patients' protocols as you see fit. You can also find it in sometimes where it's paired up with D-chiro, and D-chiro improves insulin sensitivity as well. Helps to improve ovulation and serum androgen levels specifically. So that is a key differentiator between myo and D-chiro. But the research actually does show that the ratio, when you combine them, that you want the ratio of myo-ionisitol to D-chiro to be 40-1. And that's really what you're looking for. It's actually difficult to find just D-chiro on its own, quite frankly. And with that research, you don't really want to prescribe it so much on its own. You'd rather find it in combination with myo-ionisitol. CoQ10. So CoQ10, ubiquinone in this specific case, is an antioxidant, a powerful antioxidant. I imagine that many of you already incorporate this into your protocols. Helps with cellular energy production, supports healthy ovarian reserve, and reduces the effects of reproductive aging. This is, to me, is a key nutrient that should be in most, if not all, couples protocols. You'll see in a future slide when I go over male fertility, I also incorporate it there. And this is something that's really important. We want to basically reverse the aging process and start to support healthy cellular function and energy. And this is a key nutrient that can do that and support ovarian reserve as well. So this, in my book, is potentially at the top of the list when you're talking about nutrients to incorporate. CoQ10, so impaired mitochondrial performance created by suboptimal CoQ10 availability can drive age-associated oocyte deficits. So we can already see that when mitochondrial function is impaired, we have a decrease in oocyte health, right? And so we want to support follicular health, and we want that to be optimized. And so CoQ10 can really do that dramatically, which is, again, another reason why we want this at the top of those, or why I think of it as a key nutrient that I want at the top of the list of supplements that I'm going to be prescribing or recommending. Melatonin. Now, melatonin is often, so I think it gets a bad rap in one sense, and I think the other piece of this is that we only typically think of it in one way. Melatonin is 95 to 98% of the time thought of only for sleep issues. If you are traveling, you're having difficulty sleeping, this is where we think of melatonin. And yes, obviously, it is a key nutrient for that, right? But melatonin for women supports intracellular melatonin concentrations and reduces, and reduces intrafollicular sorry, let's start that over. Melatonin for women supports intrafollicular melatonin concentrations and reduces intrafollicular oxidative damage and elevates fertilization. So this statement should really get you to start to think about melatonin a bit differently. I tell you that for sure for myself, it has, right? I always used to just think of this as a sleep support. And if patients didn't have sleep issues, then I was not thinking of using melatonin. Now, this research really got me to think differently about melatonin because it protects oocytes from free radical damage. So it's basically acting as a powerful antioxidant, right? Now, how many of you really thought of melatonin as a powerful antioxidant? I know for myself, I was not in that camp. So I imagine most of you are the same, that you thought of it primarily for sleep. Obviously, it can be used for that. And it's a bonus if we get a patient who needs sleep support and needs a good antioxidant to support follicular health. Well, then melatonin's a no-brainer. But I also think it should be thought of in addition to the, outside of that sleep issue as well, which I think most of us ignore or forget about. So antioxidants. Antioxidants are key, and we'll get into a couple of them that I really like. But first and foremost, antioxidant supplementation may be effective in controlling the production of ROS, which is reactive oxygen species, and continues to be explored as a potential strategy to support reproductive function and fertility. We often think of antioxidants when we are thinking about regulating and supporting egg health. And this is no different here. We talked about it in the last slide about melatonin, right? And so let's get into some other antioxidants. The two big ones that I think are key factors to incorporate into a protocol that you're developing for a couple would be grapeseed extract and resveratrol. So grapeseed extract is an antioxidant, as we've just mentioned, and it's effective against fat-soluble and water-soluble free radicals. So this helps on both sides, fat and water-soluble, which is great because you can have one nutrient that can help you on both sides of it versus just putting together multiple nutrients for that. Resveratrol, resveratrol in this case, protects cells from oxidative damage as well, protects mitochondrial function. We've heard that a couple of times, right, from some of the other nutrients that we've mentioned. Enhances telomere activity, which is also really important. Animal studies show potential ability to favorably impact both egg quality and quantity with resveratrol. Now, I think most of us don't think about using, or haven't in the past, thought about using resveratrol when we're working with our fertility patients. We've thought about different antioxidants. Hopefully this gets you to start to think about incorporating resveratrol a little bit differently, and that you might put this above some other antioxidants you've been using because of these favorable research studies that have been done using that. Now, you can often find both grapeseed extract and resveratrol combined together when you're looking at supplement support. But if you wanted to isolate them, you can, and this is where you would start to see those, or this is how you would start to see those benefits as well. NAC and glutathione. This is one of my favorites. I feel like I've said that a couple times because I like these all for different reasons, but I do really like NAC quite a bit. Obviously, it's an antioxidant because we're talking about it in this antioxidant category, but it's also a precursor to glutathione, and glutathione is not metabolized well through the small intestine. So I know glutathione tends to get most of the top billing when you are reading and research and thinking about incorporating different antioxidants. And I love glutathione as well, but NAC is wonderful because one, it's a precursor to glutathione. It's also a key nutrient and cofactor for so many other reproductive issues and support for other reproductive conditions. So it's really a nice one to start with and then potentially add on glutathione periodically here and there. NAC is more likely to raise glutathione levels, and glutathione supports healthy detoxification, including excessive hormone production, and NAC supports ovulation. So it does so many things. One of the ways that I determine when I need to use glutathione over NAC, or maybe I decide to combine both of them, is I often use a test called the Dutch test. It's a dry urine hormone panel. And on page 3 of that report, they, when we're talking about estrogen metabolism and estrogen production and levels, there is a line on that report that shows you if they're using and able to methylate and metabolize estrogen properly, or that specific type of estrogen. And also, if it's not working properly, you can see that glutathione is a key resource in that process. And so it's an easy way to start to know when you want to incorporate glutathione specifically. So when I see that, I will incorporate both NAC and glutathione, but I will routinely incorporate NAC on its own because of its value in so many ways. And obviously here, that precursor piece to glutathione is very, very important. And we all want to support detoxification so that hormones are regulated and balanced. We talked about that earlier on, so that we can have a regular cycle. Another bonus, as I already mentioned, is that NAC supports ovulation. So that goes back to wanting to have a regular cycle, regular ovulation, regular menstruation. NAC can have profound effects there as well. ALA, alpha lipoic acid, acts as a water-soluble and fat-soluble antioxidant. Lab studies show it can support egg maturation and egg viability, which is also good. I often don't use ALA on its own. I will have it as part of a blend of nutrients that I incorporate together because it's just easier for me versus giving all these little pieces, which I'll get into in just a little bit. But I do like ALA. I think it's very important. I just don't often give it on its own. So exactly what I was just talking about is how should you approach incorporating these nutrients? You know, we've got specific ingredients like we just mentioned, these key nutrients versus multi-ingredient supplement approach. And there's no right answer specifically for patients. I think there's going to come, I think each patient has to be looked at differently and uniquely, but also I think it comes down to your preference as a practitioner. How do you want to approach this for patients? How do you think it's best for them, for their specific needs in their specific situation? For some patients, it's going to make more sense to pick out the key nutrients you want to give them that we just mentioned and put those together maybe with Chinese herbs or something else that you're doing, because that works out better for what your long-term approach is. For others, it might be better suited to actually find that multi-ingredient supplement that you can blend that has everything already blended together, because it's going to be easier for you, easier for the patient. You know, when I have my difficult patients who are like, I can't take that many supplements, I tend to look for just one versus all these different things because it's confusing to them, it's overwhelming. And so that's one of the different ways that you can decide how you're going to go about it. The other piece to this is a multivitamin support helpful in addition to the specific ingredients like myo, inositol, CoQ10, and all the others that we mentioned. So by this, I mean, are you going to look for a multi-ingredient supplement that just has those key ones that you're looking for? So if you're looking for CoQ10, inositol, both myo and D-chiro, and let's say one of those other antioxidants, are you going to look for something that just has those 4 things in it? Or are you maybe going to find something that's a little bit more comprehensive? It has all their basic key vitamin nutrients, so it's going to act like as their multivitamin, and in addition to that, have all these key nutrients to support their reproductive needs. So again, this comes down to preference, patient, and condition. And I think it's going to vary from person to person, clinic to clinic, and patient to patient. But those are options, which is why I put that out there. One of my favorites is FH Pro for Women by Fairhaven Health, because they don't hide their dosages in their proprietary blend. So you know exactly what the patients will be receiving, which I really appreciate. Most, if not all, of the other multi-nutrient supplements and fertility support vitamins that I have seen don't give me the exact dosages of the nutrients. So it just says proprietary blend, and it give me a general number, which is not great for me because I want to know exactly the dosages and amounts that each one of my that my patients are getting for each one of those specific nutrients, because I'm picky. I might want one. I might want more of one and less of another. And so, quite frankly, until I found FH Pro, I was kind of piecemealing it together. They made it much easier for me as well. It also happens to be a full multivitamin along with the ingredients targeted for reproductive health. And I know that there's a lot of fertility supplements out there. I would just encourage all of you to look at, when you're looking at multi-ingredient supplements, first of all, look at what those multi-ingredients are to make sure you're comparing apples to apples, but also make sure that you can see all the dosages for every nutrient. And which is why I really like FH Pro for that reason, because I can see exactly what I'm getting, and they don't have their proprietary formulas put together. So now moving on for cervical mucus and vaginal dryness. This is a key thing for me when I talk about with patients. Patients always bring up their cervical mucus. Obviously, if they have vaginal dryness, it's uncomfortable. Intercourse is painful. It's not fun for them anymore. So one, we need healthy cervical mucus so that we can create a proper healthy environment, right? So that the sperm can get to where they need to go more easily and in a healthy vaginal canal. But also, you want sex to be fun. I mean, I want sex to be fun for my patients. I don't want them to be hating it. I don't want them to be dreading it. And the only time that they have intercourse is around ovulation, for that one time where they got a positive OPK. I want this to be, I want intercourse to happen more fluidly for them, more easily, and with less concern. So we need to have a healthy and safe vaginal environment to make the journey, obviously, for the sperm as easy and safe as possible. And what are the main issues and why? Well, vaginal dryness, as I mentioned, is a key one. We need to have healthy cervical mucus so that cervical mucus is becoming nice and egg white around right at ovulation, and maintains that for enough days. And some of the ways that I determine this is also going back to that hormone testing, right? I want to understand if they're having an issue with their cervical mucus and with vaginal dryness. I want to get a better understanding for why that's happening. And so I often incorporate hormone testing here as well. Hopefully I've already had it tested when I'm looking at the bigger picture, but if I haven't, then I'll definitely go out of my way to have that tested again and make sure that I understand what's going on with their estrogen levels and progesterone and testosterone, so that I know how to adjust things for their specific needs. So some key nutrients that can be really important and supportive to create a healthy cervical mucus environment is NAC. We talked about NAC before when we were talking about egg quality. And you could use NAC in so many ways. As I mentioned, here's another one. Studies find that it softens cervical mucus and makes it easier for the sperm to get to the egg. I rarely ever see anyone ever mention this piece of information in this study, but it is important and valuable and can make a big difference. I also like to incorporate evening primrose oil, EPO, in the follicular phase of a woman's cycle to help with healthy and normal cervical mucus. And I love to incorporate Chinese herbs. For me, this is a big one as well when we want to address cervical mucus and vaginal dryness. This is where I might not actually give a patient a choice if they allow me that, where I might try to actually incorporate all three. And then on top of that, So I do these three because I want to change the cervical mucus for them physically, right? I want their body to start to create a healthy cervical mucus at the right time of their cycle, and to minimize any vaginal dryness throughout their menstrual cycle. So these I will start to incorporate. In addition to that, I will often incorporate a lubricant as well, because I need a bridge to get from coming in and complaining about cervical mucus and vaginal dryness, and I need some time to be able to make those changes. And so I'll have a bridge to get there, and that's where the lubricants come in. Obviously, patients cannot use just any lubricant. It's really important that they are aware of that, because you'll hear them using all sorts of things when it comes to lubricants. Lubricants should be cleared as fertility-friendly lubricants. This is actually a medical device, and has a Class 2 medical device grading when you're talking about lubricants. There are not many lubricants that are cleared in this way as being fertility friendly. And what this means is that they don't impact sperm parameters. It doesn't affect negatively any of the sperm parameters that we'll talk about in just a minute. The other key thing that I look for is that it doesn't have any toxins. I don't want them to have any parabens in the lubricant. Our patients are already exposed to enough junk, right? So we want to minimize that. And I don't want any of those coating oils. So I do prefer that they're water-based lubricants. Coating oils, like if you think about someone who, and I've had patients say this all the time, using coconut oil as a lubricant. That can be a problem because of the oil itself. It's so coating, it makes it more difficult potentially for the sperm to get to where it wants to go. So we want to have we want to have fertility friendly, doesn't affect sperm parameters, no parabens or toxins, no coating oils, and pH balance to match fertile mucus. There are not many of those. Actually, I think there's only 3, possibly only 4 that are cleared as medical devices to be used in this way. And my preferred one is Baby Dance, because it's the only one that I'm aware of that does not have parabens, those toxins, right? So this is the one that I prefer to use and recommend. I sometimes have a bunch of samples in my office that I'll actually give out to patients, and then I'll just send them back to Fairhaven for purchasing and keep it easy in my office, so I don't have to stock it. But this is my favorite one to use in conjunction with those other nutrients, because those other nutrients will help us get make the physiological changes we need to, so that their body can start to create and have healthy cervical mucus and reduce that vaginal dryness, have more moisture. And this helps as a bridge, especially when they're trying to conceive, so it becomes easier, less painful, less uncomfortable for them. All right, so common issues with male patients, right? Sperm health, the parameters such as count decline with age. They're also impacted by the environmental toxins. And the key areas that we want to focus on are sperm count, motility, and morphology. So we do know that oxidative stress has a negative impact on sperm health parameters, again, which includes count, motility, and DNA integrity, which is part of that morphology piece. And as I mentioned when we were just talking about lubricants, we don't want that lubricant. Sperm have a hard enough time doing their job without any additional barriers, right? So we don't want to create any additional work for them to do. That's why that lubricant is so important if it's needed, because it creates a healthy environment and a safe environment for the sperm to get to where they need to go without impacting any of these parameters. But I also will coach my patients on lifestyle changes. Exercise is key here. Diet is essential, and temperature of the body and the scrotum are also key pieces here that can impact all of these parameters. So if you're not talking to your patients about exercise, if you're not talking to your patients about having a good diet, and if you're not talking about keeping that area nice and cool, then you've got some work to do, and they've got some work to do, right? So this talk is specifically on nutrients, which I'll get into, but I didn't want to ignore these pieces, because this will make your life a lot easier and make the changes happen more easily for them. Now, they might not like to make some of these changes because they are difficult to make, but they definitely can have some profound changes for patients. So nutrition, high inflammatory fat intake, heavy caffeine, high red meat intake, low veggies and fruit intake, and also lifestyle, low physical activity, high stress, high scrotal temperatures create more oxidative stress, okay? Which damages the sperm DNA and impairs count, motility, and morphology. These variables alone, if you just spend time with your patient addressing diet and lifestyle, can have huge changes for the male partner in reproductive health, right? So if you're not spending time here, and they hate it, they hate changing their diet, they hate it, but I talk about it so often with them because it's so important. We want to reduce the inflammation, the alcohol intake, which I didn't list here, caffeine, have healthy diet, increase physical activity. We know that increased physical activity will absolutely help their quality of their sperm, reducing stress, and obviously lowering that temperature so we're not heating up and burning up the sperm. So if you do nothing else with your patients, this can have profound effects. But obviously, I think we can get those effects a little bit faster, a little bit easier, and hopefully with greater results if we incorporate some nutrients. So antioxidants, which are well studied and have great results. We're going to talk about a few of them, but I want to go over some of these, some of this research first. So antioxidants play an important role in protecting semen from ROS, which we talked about before, oxidative stress essentially, and can improve basic sperm parameters like count, motility, and morphology. Also, they will help with DNA integrity, right? Results suggest that antioxidant treatment improves sperm quality, not only in terms of key seminal parameters, but basal DNA damage as well. And beneficial impacts of antioxidants on reproductive health. So we know that antioxidants have a great effect. We talked about them and their benefit in female fertility. And now we're going to talk about these in terms of male fertility. So N-acetyl-L-cysteine, preventing cells from free radical damage, right? Grapeseed extract, we talked about this one before, is a powerful antioxidant, has rejuvenation effects and rejuvenation effects of other antioxidants. So it makes the other antioxidants stronger and is in itself is a powerful antioxidant. And then lycopene, supporting sperm quality, including count and viability. I think we often ignore lycopene when we're talking about male fertility, but I do think it's an important one. And grapeseed extract, look, we talked about it before. We can see its importance again. This is an easy one to incorporate. So key basic nutrients also that are going to be important for male fertility. Folate, zinc, and vitamin E can support healthy sperm concentration and motility. Sometimes these get ignored for the bigger ones, right? We tend to ignore some of these smaller, more common, if you will, nutrients. And because we're thinking about the bigger ones that are talked about, they get more notoriety, but these shouldn't be ignored because these also have profound effects. And poor zinc nutrition may be an important risk factor for low quality of sperm as well. And so we do need to address that. CoQ10. So CoQ10 increases both ubiquinone and ubiquinol levels in semen, which is going to help with quality. And antioxidant, it's an antioxidant that protects sperm cells. Studies show the more CoQ10 available in seminal fluid, the higher sperm count. That's reason enough to take it. And I really like to focus on sperm count quite a bit because all the other numbers, when you're talking about sperm quality, are percentages based on count. So if we can improve count, even if we can't improve the other percentages, which we typically can, we're going to see improved numbers anyway. Also, we have carnitine and arginine. Carnitine is a vitamin-like compound that helps transport fatty acid into the mitochondria where they can be burned for energy. It helps sperm cells create energy needed for motility, seems to prevent cellular death, although mechanisms are unclear, and could act as an antioxidant. It increases seminal volume and motility, which is a key one. I often think of carnitine for motility in this case. And then arginine is an amino acid necessary for sperm production. It's a precursor for nitric oxide, which is required for sperm motility and erectile function. I also often think of arginine for morphology. So why I think of FH Pro specifically, FH Pro for men specifically, when I am thinking about a male fertility supplement, is it has the specific ingredients that I just mentioned in the right dosages that I like, excuse me, from Fairhaven, which I really trust as a company. It's easy for them to take because I don't have to typically give them anything else. I can give them this one supplement. And for men, that's really important because they want to keep things easy and straightforward. And I can just say, just take this. This is pretty much all you need to get the results. In addition, they have some wonderful research around this. And this product specifically, and this study that I'm showing you right now, is exactly how I started incorporating the FH Pro products into my clinic with my patients. Because when I saw this research study, it really impressed me. And if there is a product that can have these sorts of an effect, this sort of an effect on male fertility and parameters, and I can just give one thing, then not only is it making my life easier, but my patients are going to be happier because they just have to take one thing and think about one thing. So we can see that before the treatment, the sperm count was 22, and the percent change after, the percent change was 37%. Motility, the percent change was 101%. Normal morphology improved by 39%. DNA fragmentation, which you want a lower number with DNA fragmentation, so we want this number to go down, improved to 17%. And then oxidative reduction potential also was reduced by 39%. These are huge benefits for patients, right? This is a big deal when you're talking about male fertility to your male patients in couples. But this specific research study that was done at the Cleveland Clinic really stuck out for me. Okay, so researchers sought to evaluate the impact of antioxidant supplements on the sperm proteome of men with suboptimal sperm health. In this prospective study, men were given FH Pro for men, a combination antioxidant dietary supplement for 180 days. The results showed that supplementation with FH Pro for men resulted in increased expression of sperm proteins associated with spermatogenesis, maturation of sperm, sperm binding function, and fertilization process, suggesting a possible explanation for the well-established benefits of antioxidant supplementation on sperm health. So this is key. The one thing that I often might add to this, especially with my patients who need a little bit more support when it comes to morphology, is I might add some additional L-arginine. The dosage in FH Pro is 500, and I typically like to be around 1,500 or so to 2,000. But for me, if I just have to add in that and on occasion, it's not a big deal. And this is much easier of a product for someone to take versus piecemealing it together, which is exactly what I used to do. And so I was introduced to Fairhaven with this specific product first, and then I started incorporating the other FH Pros and Baby Dance afterwards. So as Lauren said in the beginning, and then we'll take some questions, I'll turn off the presentation or the share, and I'll come to you with just my face and answer those questions, is that Fairhaven has an offer for all of you. It is on that page that Lauren had mentioned, but it's also 20% off for wholesale orders, either new or existing customers through July 15th. You just need to use that healthy coupon code there. They're great to work with, easy if you want to just send patients to their, if you don't want to stock anything and you just want to send patients to their website to get it on their own, they also have a referral program as well. And you can use that URL, fairhavenhealth.com/referral-program to see all the information that you need to start incorporating it into your practice. So I'm going to stop sharing. Lauren, are there questions that have come up?
Yeah, we'll do some questions. And I want to again thank Marc for putting this together. And I want to thank Fairhaven for sharing this. So we'll take a few questions. Just a reminder, the replay will be on the healthyseminars.com/Fairhaven. And so this is where the replay will be. And then if you're looking for the information about Fairhaven, how to access the handouts, then come here, and there's information for the special offer at the bottom as well. So that's where you'll go for that. Just wanted to remind you of that. I'm glad you talked about the men, because, you know, it takes two to make a baby, and so much focus is always on the woman, even when it's male factor for fertility.
Right.
And it's, you know, again, why the FH Pro for men is so great is we have a program in our clinic, we call it KISS, keep it simple for your stud, KISS, right? Basically wanted to make it simple for the guys. If they have to open up 5 bottles, they won't do it quite often.
They won't.
And so this was nice because of what Fairhaven's done is putting it all together. Then it just makes it easier for the guy. This is their bottle. And so it's a nice.
Yeah, product. Lauren, on that note, I should say, you know, the dosage for the FH Pro for men is 6 capsules per day. So some men might balk a little bit at that. But I often tell them, you're either going to take these 6, or I'm going to give you 10 to 12 in combined, you know, 5 or 6 other products. So which one makes more sense to you? Which do you prefer? But we've got to get you those nutrients either way, right? So how do you want to take it? This to me is a no-brainer. It's much simpler, much easier for them.
It reminds me of a couple I worked with, and the man was a little bit resistant because he said, well, I don't want to pay for all these supplements and take these pills. And I said, have you checked to see how much ICSI costs? And he said, I'm going to take these pills.
Right, exactly.
So it's a little bit easier. And your spouse doesn't have to go through all those hormones injections. Now, obviously, sometimes they need to do the IVF, but as you know, sometimes correcting male fertility, and so much more research has shown that IVF failure, unexplained fertility, and early pregnancy loss, they're contributing more and more to the guy. So men are easy to treat if they come in and if they take your supplements, but men are making new sperm. It was just good to hear you talk about the men, because so often people don't. And I have to tell you a quick story about the NAC. Do you remember that movie, My Big Fat Greek Wedding?
Yeah.
And the old guy Windex everything? NAC is my Windex. I use it. It works for everything. I give everybody NAC because the inflammation, you know, it's good.
It works great. Yeah. I use it all the time. And as you just mentioned that movie, I was thinking to myself, he's going to say it's his Windex.
It's my Windex. When people go, why do you give NAC? No matter what I come in for, you tell me take NAC. I go, it's my Windex.
That's great.
I take it. If you're going to do a little bit of extra drinking, then build up your NAC reserves in your body. And again, it's the precursor to glutathione. Yeah. All right, a couple of questions here. Now, there's a lot of questions about dosage, and we don't have exact time for this. But if you're somebody from the public, then talk to your healthcare provider, obviously, about dosaging. And a lot of the research that Marc has shared, you can look at the research and see what the dosaging is. And I know Ethan's here. Ethan, where can people get Fairhaven products, by the way? I know it's available in Canada and the United States. You can get that. Some people asked about New Zealand, Australia, and the UK. Are they available there?
Sure. Yeah. I mean, we're pretty all across the U.S. and Canada and a number of countries. Some countries we just can't get into. New Zealand is one of them. But I don't know how they do it, but there's a company called iHerb that seems to be able to get our products into every single country around the globe. So you should check with them. They do carry FH Pro and Baby Dance and pretty much all of our products. I know in the UK, we work with the National Fertility Society, a woman named Sandra Bateman, and she has our products there. And then we're on Amazon UK as well.
Perfect. Thank you for that.
Yeah.
For L-arginine, there's a question about like herpes. Do you screen patients? Because some people, there's that concern that the herpes will feed off of the L-arginine. Do you have a concern about that, or you give it to anybody?
Well, so I mean, there is a concern for that, right? The L-arginine is in the products we're discussing here through Fairhaven is just in the FH Pro for men, it's at a lower dose. That 500 doesn't concern me too much in that regard, but everybody's sensitivity is a little bit different. But if they do have herpes and we're concerned about an outbreak, you do have to consider that, and you might have to make adjustments in some way.
There was a question about what's your thoughts with IVF clinics or IVF IUIs taking these supplements. And I think this comes with some clinics historically were uncomfortable with Chinese herbs during an IVF cycle. Do you have any, and I'll share from my clinical experience here as well in Vancouver at AccuBalance, but do you have any pushback from IVF clinics about their patients taking any of these supplements during an IVF?
No, I don't. I will stop them right before transfer. We can get into the conversation about, fresh or frozen and when you stop it, but I won't have them take it from transfer on. I'll switch them to a prenatal at that point. In this case, specifically FH Pro for women, because it's not meant to be taken once a woman's pregnant. So you will switch to just a prenatal in that case. But for men, I'll keep them on it as long as I can keep them on it. I don't have an issue with that. And for women, I just take it up until retrieval, and once they're done retrieving, then we can stop and switch.
In Vancouver, as of 2020, just so you know, back in the day, I've been in practice since 2000, they used to make patients go off of CoQ10 back in the day around 2000, 2002. Now the clinics sell melatonin, CoQ10, all the patients are all on it, the male supplements. So they're all prescribing it in Vancouver, anyhow, Canada. Most of the IVF clinics are putting the male and female patients on the supplements that we're talking about here today as well. So,
yeah, Lauren, on that point, I should mention, that's exactly the case. Most IVF clinics are recommending a slew of supplements. Most of the things that they're recommending are actually the nutrients that are found in the FH Pro product. So that makes it easier for them. And two, if they're often recommending a specific supplement that they prefer over FH Pro in this case, I'm telling you, I've compared ingredients and labels of all of them. This is how I ended up with FH Pro. Okay, because I think it's a more comprehensive, much better balance, and it again has the nutrients that I'm looking for in the right dosages. So,
and I know our patients really like the baby dance. I like the name, by the way, but they like it because if the people having such regular intercourse around their fertile window, and as you know, the spontaneity, the enjoyment is not always there, although we are encouraging to be enjoyment, and for two reasons, it makes the intercourse much more pleasurable, but B is it actually helps with bringing the sperm to the egg, right? So that's really good. Do you use the Dutch test to help you decide whether you want to use melatonin or not in women trying to conceive?
Yes. That's not the only, I won't run a Dutch test just for that. I should be clear. I'll typically run it because I want more information, but as one of the areas that I'm evaluating to decide if I want to incorporate melatonin, yes, I will look at the melatonin levels. And that's a perfect example. I had a patient who I just read her results, and her melatonin was ridiculously high. And so in my mind, I was sure she was taking melatonin because that's typically when you see it. And but I just figured she hadn't told me because I didn't have it documented anywhere. And when I asked her, she said, no, she's not taking it. I was like, okay, we're going to have to figure this out. So in her case, I wouldn't incorporate melatonin.
Great. Somebody asked, baby dance is their lubricant, so it's the actual name of a lubricant. So it's a lubricant for intercourse.
Also how patients will refer to intercourse as baby dancing.
So. Right. Yeah. So it's just a lubricant. And I think that melatonin, somebody's asking about dosage. I think the early research, what was it, 3 milligrams was what they did for the fertility. Was that?
Yeah, I don't like to go that high personally if I don't have to. So I should be clear. If I'm giving it separately out of the FH Pro product, then I won't go that high. If I'm giving it in conjunction, then yeah, it's fine. But I won't go over. I've had some patients at like 10. And I won't do 10.
Okay.
That's too high.
Perfect. I want to thank everybody for their questions today. Again, if you want to get the handouts for this talk, because I know Marc referenced a few studies which will be of interest, then you can email Fairhaven directly. And that email is wholesale@Fairhaven Health. I keep calling them Fairhaven, but it's fairhavenhealth.ca. Sorry, that would be Canada.com. Wholesale@fairhavenhealth.com. And also you can just go to the website, fairhavenhealth.com too, if you forget that email and contact them. They'll tell you, let them know if you've been on the webinar. They may have a special deal for you. There's some students on here. Contact them because you're asking about setting up an account if you're a student right now. So you can check with them as well. And I know our patients like their products, and for us, we got introduced to you guys through the lubricant and the LH strips and the pregnancy test strips. That was the first introduction we had. And then I want to thank Fairhaven Health because they've been coming to the Integrated Fertility Symposium for years, and they're always making these products that are, we like in Chinese medicine, if you can find one thing that can treat many things. So rather than having to take a CoQ10 bottle and this bottle, it's nice when you can get a combination and they do a nice dosage of that. And Marc, it's good to see that we have a lot of similar thinking around our Windex, the NAC. Now, I know there's a lot of Americans on here, so I got to say this disclaimer. I'm not saying to use Windex for your fertility. Okay? I said it's like my Windex, but I'm not saying use Windex. I use NAC. Just because we got some Americans on here, we do have to make that very clear.
That's funny.
Fairhaven Health does not sell Windex for fertility. Okay.
No. Most other things, though, you can get your home pregnancy test and all those other things there as well.
Yeah. So, again, thank you guys for your questions. Check out healthyseminars.com/resources to see what we have going on. And then if you go to the June 22nd date, if you're looking for this, I want to see the replay or I want to see the link to get to Fairhaven or what was their special they had for us. From the resource page, if you go to the June date calendar and go to June 22nd, click on that, and that'll take you to the replay page, and you'll see there's information on Fairhaven there. There's information on Dr. Marc Sklar as well. I was asked if we're hiring any American acupuncturists in Canada. Well, we built a wall since COVID's come out, so it's gonna be hard for you guys to get here. The borders are closed, and we don't want them to open. Just teasing you guys. All right, wishing you all well. Marc, thanks for the time today. I appreciate it. Ethan,
thank you. Thanks to everybody for joining us.
Thank you.
It was really good to have a nice educational webinar for ourselves. I appreciate that. So thanks for sponsoring and organizing this webinar today with Dr. Marc Sklar. Take care, everybody. Until next time.
Bye, everyone.
Thank you.